a younger patient. I think, in my opinion, I think that there are two main concerns when you have to deal with younger patients. The first is the durability, and the second is the coronary access in the future. So our case here is a male 71-year-old with gradually worsening effort dyspnea and arterial hypertension dyslipidemia and left nephrectomy due to kidney cancer, prostatectomy, pelvic radiation with elevated risk scores. So the screening coro didn't show any significant coronary artery disease, while the screening echo revealed an AVA of 0.8 good preserved left injection fraction and high aortic gradients. Here you can see the screening echo and the elevated gradients here, and the screening coro. You can see the left and the right coronary artery. From the CT angiography, you can see an annulus area of 481.3 and an annulus perimeter of 79.1. Here you can see the calcification in the aortic annulus and the angle. And we have a promising femoral access from both femoral arteries. So our choice here is the Edwards Sapien 3 Ultra Resilia 26 millimeters. You can see now the video from the live case. So we start here with the puncture of the femoral artery with echo guidance, always near hospital. Here you can see the ProGlide system. The preparation of the valve. It's a Resilia valve, Edwards Sapien 3 Ultra Resilia 26. Where we're going to use is the Safari Small, and we start with a predilatation with an Osypka 2040 balloon. Here you can see the gradients. And the predilatation.
Actually, balloon expandable valves are really fast to implant, right? So for a busy program like yours, it comes handy, I think. What's your take on that?
Well, I think so. I think you are faster. You are faster if you have the most experience. But in the Evolut platform, we're really fast because we have been doing a lot. So it's in most of the patients, it's like 35 minutes work. So I think it's very important to have a proper pathway, and people are accustomed to what you do. The nurses, well, most of them, and. The first, the second operator has to be a collaboration. So if something, impedes this pathway, you have a problem. But maybe some temporary delay. But it's what you are getting used to it.
So you can see the valve now, the delivery system.
So compared to the other live in a box that we saw, we see it's a different kind of preparation. So the valve is aligned inside the descending aorta.
Okay. The angiogram, and here the orthography, and now the delivery of the valve. You can see here no peak-to-peak gradient. Good result. And now it's time to pull everything back. And
So
close.
it's a standardized approach. We do it in, in many patients.
So you've
different
already
subset
brought
of
the
patients.
next case, right?
Yeah, so it's...
I think both of them are very high quality products. I mean, I have to say I haven't got experience with SAPIEN technology, very limited, but I think the centralization relies also on your wire skills and, and you have the knobs. Yeah, I think in most cases, both of them work very well.
Good result. You can see here in the echo. And that's all.
The only issue is if you cannot cross for some reason with the SAPIEN, then you cannot take it out, right?
Yeah.
That's the problem. It's very unlikely to happen for most contemporary.
Actually, yes.
Yeah.
But actually, it never happened to us. And,
Sure.
I suppose in the majority of the operators, but it can happen. Maybe in the older days, Greg, if you remember, it could happen from time to time. I think that these are very, very, very nice valves. The hardware has been developed so much, and it's easier to place the best valve for the best. Yes. I think the idea is to have a personalized approach. Yes. And to do the best you can to place the proper valve for the proper patient. If you have a small annuli, there are certain valves maybe they are better. As I said before, to have a lifetime management for every patient, you have to give the correct information. So while we're waiting for the next session to begin and for Francesco Maizano to log in, maybe we can start with classes on patient selection for TMVR interventions.